everyone, welcome to my channel. If you are new here, I'm Amy. Welcome. I make videos geared towards helping you live your best life, so if you're interested in more videos like this one, please consider subscribing. Today's video is a follow-up to the video that I posted recently about my journey with pilonidal disease and my experience with the cleft lip surgery. So if you haven't seen that yet, I advise you to go ahead and watch that before watching this, just because it will kind of go hand in hand. Just as a disclaimer, I am not a professional. I am not any kind of doctor. I'm not in the medical field, nothing like that. This is purely based off of my experience. Take it as you will, and I hope that this helps somebody out there. So let's go ahead and get right into it. So if you are somebody who has pilonidal disease or is going to get the surgery, personally I got the cleft lip surgery that I think is definitely the one to get. I actually got it with Collin County surgeons in McKinney, Texas with Dr. Lambert. They did an amazing job and they were an amazing support system throughout the entire 6 months that I was healing after the surgery. So a huge thank you to them. So let's go ahead and get started with my list of advice for you. Definitely do your research when it comes to this disease with the surgeons as well as procedures to help with this disease. Be prepared for life to change a little bit for a while after you get this surgery. One of the most uncomfortable parts of it was attempting to lay down on work or really sit even is uncomfortable. The first few weeks really, I tried to lay down and do my work and that made my body feel so uncomfortable. It really has altered my life for the past 6 months or so when it comes to driving, sitting, and things like that, but it's not horrible. I definitely take it over having the pain of the cyst. Be prepared to pay the surgeon, the anesthesiologist, and the hospital depending on what insurance you do or don't have. Make sure to have somebody there to help you throughout the first week after the surgery with changing the gauze, cleaning the drain, and just helping you out overall. If you do get a drain, you cannot take a normal shower while it's in. For me, I had it in for a week, so I was not able to take a normal shower for a week. You will have to wear loose clothing in the beginning, especially around the first few weeks of having the surgery. I recommend getting the surgery in the winter or fall time so that you don't have to necessarily miss out on the fun stuff of summer. Sometimes you may see blood after the surgery. This is not completely unusual, but if you do see a ton of blood, I recommend that you contact your doctor immediately. That's what I did. I actually looked down the toilet one time and I saw a waterfall of blood falling from the incision, and it was very scary, but he reassured me and everything's okay. Be prepared to spend additional money on supplies to help with the wounds. We spent a good amount of money on the gauze, the tape, and things like that, even things to help you use the restroom and stuff like that. Try to eat as many natural foods as possible right after the surgery to avoid getting constipated like I did. Truly, eating natural foods and eating foods that are good for you are going to help with the surgery and help with the healing of your incision and your wound as well. Try your best to go number 2 a few days after the surgery so you don't get constipated. This was actually a big problem for me. Be prepared to miss about 1 to 2 weeks, even more possibly, of work, and try to get a stand-up desk if you can at work. That's what I got. We also got a couch, which was really nice and really convenient. And also be prepared to have to go to appointments. I went to the doctor once a week for 2 months or 3 months or something like that. And then I went to every 2 weeks, then I went to every month. So just be prepared for that. Don't wait too long to change your gauze pads, either on the drains or the main incision. The cleaner that you are, the cleaner that the gauze pads are, the faster you will heal. Also, beware of the tape. I personally formed a reaction to the tape within a few weeks, and it was pretty bad, so just beware of the tape. Be prepared to see the scars. My drain holes are pretty much they're recovered now, but these scars are very red and they are 3D as well, so they look like little buttons that you could press. Be prepared to not be able to work out for a while. I literally did not work out for the first 5 months or so. It's good to go on walks and things like that, but don't go too hard on your body, especially your lower body. I was not allowed to bend or squat and things like that for the first few months. So you don't want to risk anything happening. You don't want to risk, it opening some more, things like that. I don't suggest that you sit on any kind of pillow for driving or for sitting or anything like that. Personally, I did not need any kind of pillow. I did not need a donut pillow. When I did sit on a pillow, it actually made my incision way worse. It actually opened it some more, and it was not a good feeling. So I don't recommend sitting on any kind of pillow, really. Be aware of what painkillers and what medicine you're taking. I was prescribed Tramadol, and that is a medicine that I will never take again in my life. It just gave me the worst experience possible. It was not fun at all. It was just a nightmare, and I go more in depth on my other video. But just do your research and listen to your body, really. Throughout this entire experience, listen to your body. Especially in the beginning, because Tramadol was not doing anything for me. It was not taking away the pain. The pain wasn't that bad, but it wasn't doing anything for that. It made me feel horrible. It made me hallucinate. It gave me, a little bit of depression and a lot of anxiety. It just kind of enhanced all of that for me, and it was really, really horrible. So be aware of what pain medicine you're taking. Be aware of if you even have to take it. If you can just take something like Advil or ibuprofen or something like that, that's probably better for you. But just be careful, because you don't want to get addicted to anything, any pain medicine. And also, you don't want your body to go through withdrawals. And I don't want anybody to experience what I experienced on Tramadol, so be careful. That is basically it for all of my advice. If you have any questions, please let me know in the comments down below. And if you've not already subscribed, please go ahead and do so. I appreciate you guys so much for watching, and I'll see you all next time.